We don't always know what's in our food. The information on packaged food is often hard to understand. Clear warning labels on unhealthy food can help us make better choices. Government's new draft regulations could make such labels compulsory, but it needs your support. Visit whatsinourfood.org.za to add your voice.
Do you know what's in your food? It sounds like a straightforward question, but the experts we have in studio today will make an argument for why they believe food labeling needs to be further developed to give us greater insight into what's on our plates and how it's affecting us. Hello and welcome to all of you joining us today. I'm Joanne Joseph, and I'll be facilitating today's Business Day Dialogues live in partnership with the Healthy Living Alliance, also known as HEALA, and its Better Labels, Better Choices campaign. Experts have long been warning us that a diet high in refined sugars, salt, and saturated fat is resulting in a growing global health crisis. This ultimately results in obesity, cardiovascular disease, diabetes, and death. More than 1 in 8 children in South Africa under the age of 5 is overweight. Now, you may be aware that the Health Department has called for the mandatory use of warning labels on food products. That would be a first. But how far does it need to go to ensure that we as consumers can make healthier and more informed food choices without having to puzzle over food labels? And how do we make our submissions on the proposed amendments by the 21st of July to ensure our voices are heard? To get a greater sense of what's at stake, you've just seen the video that we have played. And so let's take you straight into the discussion of that video, around that video that lays the groundwork for what we're about to speak about for almost the next hour. I'd like to remind you, if you're watching from home or your office or wherever you are today, please feel free to make use of the chat function. Pose your questions to any panel member that you'd like. I'll do my best to get to all your questions by the end of our discussion today. Let's meet the panel for now. We have with us Makoma Bopape, a lecturer from the University of Limpopo, Department of Human Nutrition and Dietetics. She is a dietitian with a passion for child nutrition. Makoma is also a registered PhD candidate at UWC's School of Public Health, and she's engaged in an obesity prevention project. Angelica Grimbeek is a policy and research manager leading HEALA's technical resource development. She previously established and led the dietetics and food service departments at Bronkhorstspruit Hospital. As part of her MSc in community pediatrics from Wits University, she published research on the post-discharge outcomes of severely malnourished children. Her area of interest is food justice. Mikateko Mafuyeka is a researcher at the SAMRC Wits Center for Health Economics and Decision Science, also known as Priceless SA, and an admitted legal practitioner at the High Court of South Africa. She has an LLB and an LLM from the University of Pretoria. Her work at Priceless SA focuses on policy and health analysis. And Petronelle Kruger is similarly a researcher at the SAMRC Wits Center for Health Economics and Decision Science. She's also an admitted legal practitioner in South Africa's High Court. Her current research interest is in the interplay between human rights and public health. She's also a registered PhD student at Wits University. A very learned panel indeed. Welcome to you all, and it's really lovely to have you with us this morning. So, Makoma, I'm going to kick it off with you because I think we really need to get an idea of the kind of landscape, the health landscape that exists in South Africa. And I'm going to ask you to start by painting a picture of that health landscape for us, particularly in regard to our diets and the link to lifestyle diseases. Makoma?
Thank you and good morning. I'm going to sort of paint a picture of what our health status looks like in the country. Mm-hmm. As we have rightly said, according to the latest statistics, 1 in every 8 children in South Africa are overweight, and this is becoming a problem more and more as the years progress. In fact, in 2019, there was a projection that was made that if nothing is done in terms of interventions, South Africa could be the 10th weight. If nothing is done, if there's no intervention, South Africa could have the 10th highest childhood obesity in South Africa. And that is alarming, which means something has to be done in order to protect these children. And added to that, in terms of adulthood obesity, what we see happening is, particularly among women, we see an increase in obesity. The latest results show that, which was in 2016, a national study, it shows that in every 3 women, 2 of them are either overweight or obese. And this is increasing, particularly among Black women. And in men, of course, the obesity is still high, although the increase is not as we see amongst women, but it is still high, because in every 3 men, we see 1 of them being obese. So this is increasing, and particularly if you look at the SDGs, one of the plans is we should be seeing a halt in the increase in obesity by 2025, which is about a year or 2 from now. But we are nowhere in attaining that goal. What we see instead happening is a rise in obesity. So I guess that's why we are now talking about obesity. That's why we're talking about health. And added to that, the non-communicable diseases are also increasing. If we look at what has been happening in the past, in 2012, non-communicable diseases, the ones that are diet-related, accounted for about 43% of death. In 2016, the number had increased to about 57%, which is a huge leap. And just looking at diabetes alone, in the past, it used to be the 10th cause of death in South Africa, but of late it has now jumped to be the 6th leading cause of death in South Africa. And in terms of hypertension, we also see that there's a doubling in number of cases, number of people who are now being diagnosed with hypertension. If you go, and what is alarming is this is not only happening in the privileged communities. You see it happening even in deep rural areas. If you go to clinics and you check the number of people who queue for diabetic and hypertension medication, it's really worrying. If you go to hospitals and you see the number of people that are admitted with complicated hypertension and diabetes, it's alarming. And unfortunately, this is now eating into the health costs of the country, but again, it's also eating into the individual and household costs, because the money that is spent on medication, on transportation to visit the health facilities, that could be channeled to other necessities in the household. And of course, this is not just happening in isolation. If we look at what South Africans, what we are eating at the moment, there's a huge link in terms of diet and in terms of where we are with regards to health. Several studies have been made looking at what we have been eating in the past 20 to 25 years up to now. And research shows that the majority of us eat from packaged food. Things like cereals, they have become a staple in most households. Things like biscuits, you find them in every household, irrespective of where a person resides. If you go to rural areas, there's spaza shops, and all you see is packaged food, and that determines what we as South Africans eat. There was a study that was conducted in 2018 where the researchers looked at what is available in the shops. And what was found was about 80% of what we find in the shops, supermarkets, irrespective of where one resides. It was found that about 80% of what one finds in the supermarkets is ultra-processed. It's in the package. So this is problematic because this is what we are exposed to. If I need to buy something and I go to the shop and 80% of what I'm able to buy is high in fat, high in sugar, high in energy, then it becomes problematic. So based on what we are exposed to as South Africans in the supermarket, a link has been found between what we eat and the health status at the moment. And I guess that's why we are here now talking about childhood obesity,
Right.
adulthood obesity.
Makoma, I mean, it wasn't so long ago that the laws were amended, right? Our food labeling laws were improved a few years ago. Has there been no significant change? Did those laws not make much of a difference to the way people purchase food? Is that why we're now at the point where we are reconsidering what other measures need to be taken?
So yes, currently we do have an active labeling law, which is called the R146. But the issue with the R146, which is why we now have a draft regulation, is the type of labeling that is required by the current labeling regulation stipulates that when with a product that is purchased, we need to manufacturers need to list the ingredients as well as the nutrients that are contained in that particular food product. The challenge with that is the language that is used, and as well as the numbers that are put there are very difficult for an ordinary South African to understand, even amongst us as scientists and dietitians.
Yes.
Those numbers are very difficult, and the problem is when one does not understand what is put in front of them, naturally you tend to either ignore and you don't use, or you just go for something that you might understand.
Yeah.
So the issue with the current labeling is because people, number one, find the numbers very small. There was actually a study that was conducted by the University of Stellenbosch last year.
Yeah.
It's taught and other co-authors, and they found that people were saying the numbers are very small. You need a magnifying glass to look. And when you are in the shop, nobody has the time to take off the spectacles, put them on and off, just so that you can see what those numbers are. And again, because of the scientific terminology that is used, people end up just ignoring, and they continue to buy what they are used to.
Right.
And as a result, we end up eating whatever we think is healthy, or we just buy because we are used to buying certain food. So the current labeling is not having any effect in terms of informing us with regards to the unhealthiness or the healthiness of food products.
Yeah. I mean, there's also all sorts of conflicting information. And it depends on where you source your information. But I think a pretty good example for to hold up is probably something like fruit juice. You know, on the one hand, some people will tell you it's healthier. It's certainly healthier than drinking a soft drink. But on the other hand, you'll have other experts telling you, well, actually, it's full of sugar. It's not a healthy beverage to consume. I mean, how do we navigate that with the current food labeling laws? The sort of contradictory information that comes with consuming food.
Yeah, it's very difficult to navigate or to interpret for an ordinary South African, because like you're saying, other people will say it's healthier, but the thing is, healthier is not necessarily a good choice or a healthy choice.
Yeah.
So the current labeling is not making it any easy, because it only lists what is contained. But with the draft regulations that I suppose we're going to talk more about as the interview progresses, it sort of interprets the nutritional information that is currently there. So if it's high in sugar, the current label will tell the consumer this is high in sugar. And an ordinary person does not even need to read what is pulp, because nobody understands what pulp is. Nobody understands what juice concentrate is. And those are the terminologies that are used by companies to like mask what the real contents of products are.
So let's get to the heart of what needs to change according to HEALA. What sort of changes are being proposed in terms of the new labeling, Mikateko?
Hi, thank you, Joanne, and thank you, Makoma, for basically introducing and giving us the local context in terms of the FOPL regulations. And I want to start off by saying that South Africa, as you've also stated, I just want to reiterate even further, we have a non-communicable disease crisis.
So, and I just want to look at that definition for a moment. When we talk about non-communicable diseases, because it's a long, complicated term in itself, we're talking about diseases that essentially can't be caught from each other. These are essentially lifestyle diseases in layman's terms. Am I correct?
So we don't like to use the term lifestyle diseases, but these are diseases like cardiovascular diseases, type 2 diabetes, hypertension, overweight, or obesity leads to these type of diseases. We have about 5 NCDs that are usually caused by overweight and obesity, but we don't use the term lifestyle diseases. But yes, they are not like COVID where somebody coughs in the vicinity, you can catch it.
Right,
yes.
right. So sorry to have interrupted you there. You were talking about the increase in these diseases and,
Yes.
and moving towards the new labeling laws that are being proposed.
Yes, yes. So with South Africa and even globally, we've seen that over 70% of deaths are caused by non-communicable diseases. And then most of those deaths are in lower and middle income countries, which South Africa is one of them. And then when we look at South Africa, as Malcolm has also highlighted some of the stats do not lie. We see that more people are dying from NCDs, and at some point, some of these NCDs even rank higher than HIV. And these are statistics that are provided to us by Stats SA. And we've also seen that, for example, 1 in 4 adolescent females is overweight or is obese. And we also find that it's also increasing in minor children. So that's why when these things happen and we look at, for example, international standards and we look at the World Health Organization recommendations, we see that it has recommended that member states implement, front of pack labeling as an NCD intervention or prevention policy, which is what South Africa is trying to do with the current draft regulations. And one of the 3 main recommendations from WHO there is, for example, front of pack warning labels on unhealthy food and beverages, restricting the marketing of these beverages to children, and also restricting the sale of these beverages in school settings. So we definitely welcome the provisions contained in these draft regulations as they align with these recommendations as set out by the World Health Organization. So we are following international trends and recommendations by organizations like the World Health Organization.
All right. Do you want to come in there?
Yeah, just maybe to do sort of a one-for-one breakdown between what we've had in terms of labeling and what we want to see happen now in this new draft regulation.
Yes.
So previously, what Makoma said is we had back of pack, small numbers that was not interpreted. So you had no idea what it means, what's sodium, what's 0005, blah, blah, blah.
Yeah.
That doesn't help anyone. So what the new draft regulation proposes to do is to put a warning triangle on the front of foods using an expert nutrient profile model. So someone else did the heavy lifting for the consumer to say, we've tested this is South Africa specific, this is good, this is bad. And then on the front of your packet will say, this is too much sugar. This is too much salt. This contains artificial sweetener. And that is what the new warning label proposes to do. And then, very importantly, it proposes to limit how goods who carry those labels can be marketed. So there's broad marketing restrictions, but it's specifically aimed to protect children from harmful commercial marketing. We specifically know that children need this protection because for a child, it's really difficult to interpret the difference between whether or not something is a persuasive statement or a truth statement. So a child does not understand someone's trying to sell something to me. So if you say, this is the best cereal in the world, the child goes, that's true. And then at some stage, even when children develop that recognition, there's still an issue of what we call cognition. Where effectively the child struggles to necessarily then act on that impulse or to control the specific impulse. So I see a juicy burger, but my brain has not yet developed fully to the point where I know I can't immediately go and purchase it. And that's the 2 important things the new regulation is introducing.
So while we're on the topic of this, I'm going to jump ahead a little bit, and let me bring you in here as well, Angelica, because this issue of, I think it's hugely interesting as a member of the media, what kind of implication it's going to have for the way advertising is handled in the future, marketing, in terms of the imagery, the language, and so on. Just talk us through, if this legislation is passed, what it's actually going to mean for the marketing of such products.
Yes, thank you so much, and thank you for having me as a representative for HEALA, because really this whole issue that this front of package warning labels as well as the marketing restrictions is doing is, it is a food justice issue. It is protecting our children and our adults and our nation against these harmful marketing techniques, the harmful food environment that we are living in. I mean, people really don't have a choice of what food is being eaten at the moment because of just it's hugely accessible, hugely affordable and convenient oftentimes. I mean, you often hear now in the media even how people are eating different foods because of load shedding or whatever it is. And then, of course, these huge, the food and beverage industry, they are very powerful and they are very well resourced and they're very, very clever. They have marketing teams that know exactly what a child wants to see, what people want to see, and they almost infiltrate our family systems. It becomes part of our family to have a product in the household. So what this regulation is proposing now is if a food does have a warning label on it, so if it's high in sugar, salt, or saturated fat, or has a artificial sweetener in it, then those foods will have strict marketing restrictions. So anything that really is appealing to a child. So, for example, a sports star or a celebrity cannot be a part of the labeling or marketing of it. They can't use things like cartoons, which we see all the time on packages of foods for kids. They also can't have any kind of tokens or gifts that are associated with this, as well as even branding of clothing. We've seen in the past few years that certain clothing brands are now linking with certain food and beverage brands and almost like making people walking adverts. So that won't be allowed anymore. And so, I mean, this is really, they've taken quite proactive steps to really protect children. And what's also really great and what HEALA is really very happy to see is that they have made sure that a child is defined as up until the age of 18 and not up until 12, because we know that adolescents especially, I mean, they go to school, they have their tuck shops that have all of these foods that they've just seen an advert about, so they might buy these foods more. Adolescents are also at risk of these diseases, and we know that, I mean, if already 1 in 8 children under the age of 5 are overweight and obese, what's going to happen to children and adults, and adolescents in their adulthood? So really, they have taken, the Department of Health, we really do applaud them for taking these proactive steps in protecting our children, especially with the marketing restrictions.
So, I mean, it's wonderful to have an idea of how it's going to play out. I want to get back to the research for a moment here, Mikateko. And I mean, we want to know, of course, because any legislation that will be introduced will have to be based. It will have to be fact-based and research-based.
Yes.
But I'm interested to know, are we comparing apples with apples when it comes to the research? Are there any other food labeling precedents of the kind that HEALA once introduced in this country, in other developing countries, for example?
So let's look at the case of Chile briefly, because I think it's also on the same level, right? So in 2016, they introduced mandatory front of pack warning label, amongst other legislations, to help in terms of, promoting good diet and healthy living within the Chilean population. What we saw with the first one implementation of these regulations was that there was a reduction in the purchasing and consumption of products that were high in fat, in sugar, and in sodium. We also saw that it led to individuals making better informed food choices, because when you arrive at the supermarket, they were able to say, okay, fine, this is high in salt, this is high in sodium. Yes, they use, I think it's the heptagon and not the triangle. But then that also shows that with those learnings and the work that Makoma and her team have done, when they did the research to see which type of labels will work best in South Africa, there is that adjusting and flexibility to cater to the specific context. But the labels do work, because when we take the case of Chile, where they have had it now since 2016, and it's a phased-in approach, we see the difference. We see how it promotes public health and how it leads to individuals knowing what's in their food and making better better food choices.
Right. I mean, Angelica, I'm interested to know, because we've been hearing about some of the research. How much interest is there in this legislation on the ground from socioeconomically disadvantaged people?
Yeah. So, I mean, I know that it might seem like a warning label that will be put on food might, for some people, might think they think that I'll actually end up having to still buy that food product. But I think that we really have seen, our team has been going around the whole of South Africa and really educating the communities about this regulation, about what is going to be happening in South Africa when these warning labels are introduced. And we've really seen that many South Africans don't understand what is healthy or not. They don't understand how nutrition even links to health, and how we actually do need some kind of nutritional education intervention to be able to help people understand. So something like the warning label, although it's not going to explain all of these issues to everybody in the complex way that actually nutrition is, it takes it down to a very simple level and takes it down to those nutrients of concern that are really affecting the health of the nation through the diseases we've discussed and through the stats and everything we've heard. That, I mean, if we're eating too much salt, then it's possibly going to lead to hypertension. If we eat too much sugar, it's going to possibly lead to obesity and diabetes, etc. And I mean, I always think back of when I was a dietitian and I was giving education to people that had been newly diagnosed with these diseases. I mean, we know how complex these diseases are. For a person who has had no idea that their health is at risk or has just found out that they have this very complex disease, to sit in front of them and to give them nutritional education is very difficult, because you have to break down the disease, you have to start talking about what foods they have been eating and show them, okay, this is actually something that is affecting your health, because people don't really understand. I remember people would quite proudly tell me what they're eating, and then I would have to nitpick little things and say, okay, no, actually this is maybe the where you can change this and that. And so something like this warning label, and I mean, we've heard that these diseases do disproportionately affect the poorer people in South Africa, and that's not fair, that this warning label that's been made so nice and clear and very easy to understand, where it just says high in whatever nutrient with an icon. It's black and white. It won't be hidden on the packaging. It really is hopefully going to be able to make this difference for a person that has no idea what's in their food, to really grasp, okay, if it's being warned against, then maybe I should be picking other options.
Yeah. Petronelle, this research is interesting and important to me, because I want to be clear as a citizen of the country that we're not introducing legislation that is being made at some sort of bourgeois level about the lives of socioeconomically disadvantaged people, whose food choices are obviously governed by what they can afford, but also cultural ways of eating. How do we navigate that and make sure that those voices are actually heard and the legislation benefits those who need it the most?
I think I want to just park on two things, and I want to talk a little bit about what public participation in an active democracy like South Africa should look like versus what it's looking like right now. And just to add to what Angelica was saying, which definitely does have an impact on how we view this issue, as, you know, you'll see it being mislabeled as sort of a high middle income issue. But actively what we've been seeing and what studies have been showing is that these ultra-processed food companies specifically target children in lower socioeconomic income groups. In fact, there was a study where in New Zealand where they had put body cameras on children and effectively analyzed hundreds of thousands of advertisements. And it found that if you lived in a poorer area, you would see, for every one bad ad a child from a rich area would see, a child in a lower income area would see 2 to 3 ads promoting this terrible goods. And we've also seen this with some of these leaks from these big social media companies that show that the algorithm is specifically targeting lower socioeconomic income groups. Why? Because it's an emerging market. So right now, we're thinking about it as a high-income issue. But what we're doing right now is protecting a whole new appetite, diet, understanding of food in 10 to 20 years that will basically impact every South African. Now, when we do these issues and we have these regulations coming in, who do we see coming to the table? Because who's eating? every single person in South Africa has to eat. And who's really impacted by non-communicable diseases? People for whom this is a catastrophic health cost. So everyday South Africans, who do we see making submissions? Well, we've actually done a study on 2 other health interventions, and we see 60 to 75% of the voices in the room are big corporates. Now, what do big corporates have to do with this? They make money. The more we buy this cheap, ultra-processed food, which is predominantly imported, so we're not even getting the economic benefit in South Africa, that money is effectively being shipped to the umbrella companies in Europe and in the US, which is where these massive multinationals are situated. They effectively hire a team of great lawyers in South Africa, and they're in every room, and they're making every submission, and they're busy shaping the narrative. While we actually see that community-based organizations are not being represented, which HEALA is doing a lot of work to counteract this really unbalanced idea of how we do public participation. Public participation is a very important democratic tool that was introduced with our new South African Constitution. And the Constitutional Court made it very clear it's supposed to emulate a Lekgotla, a Bosbarat. The Constitutional Court's logo is a tree. The idea is justice should be so accessible that you should go and sit outside and talk to policymakers and say, these are the issues affecting me. But what we're not seeing is everyday people being in the room. We don't have justice under a tree. We have backdoor discussions, and we have very problematic shaping of messaging by these big corporations, which even on this issue we've seen in the news, some false narratives being pushed about the food labeling.
So this is a food justice issue. Makoma, I'm really interested in that aspect because, I mean, we have a constitution that dictates justice in a lot of different areas of our lives. Food has somehow fallen behind in terms of how we work towards justice in our country. Or so it seems to me. Correct me if I'm wrong.
No. You are right. But the big issue about food is we have a few people who are in control, and unfortunately, it's industry, and industry is very powerful, and we have the poor who are struggling to buy food, and they end up eating whatever industry is producing. But because the poor do not have voices, they do not have people who can speak up for themselves, they end up succumbing to whatever industry is putting out on the shelf. And I guess that is why we need government to be speaking to the voiceless. We need government to be fighting for children. We need government to be putting out legislation which will protect those who are not able to protect themselves. And the regulation now are providing a good opportunity. And like Petronella is saying, HEALA is doing an incredible job in balancing out these disparities, because it's only a few. If the public does participate, it's only a few who are educated that are able to participate. But with the legislation that we have now, like the ground is open for everybody to be able to balance out the injustice that is happening. But the truth is, industry is very powerful, and we need the government that will be able to stand up and say, it's time that we have people knowledgeable in terms of what they're eating, what they're putting inside their bodies, by putting out labels that are simple enough for everybody to understand.
Yeah. I mean, there's part of me that thinks there's a gap in our education system, that this should be part of the learning that our children do at school. Did you want to add to the issue of community involvement in making these decisions?
Yes, absolutely. And I mean, just to add to what Makoma is saying, I mean, in the Constitution, there is these rights to access of food. But I think HEALA really, we want to take it further. It shouldn't just be access to any food. And that's why something like this regulation is going to really help almost show what the food system should be. If a food has a warning label on it, it's clearly unhealthy for us, and we shouldn't be eating it. It shouldn't be as accessible in our food system. So possibly we could be, we could be shaping this food system to create the right to nutritious food and equitable access to this nutritious food, so that every single South African, regardless of wherever you come from, whatever your financial situation is, whatever it is, that you have this right to nutritious food. And also, just making sure that we are able to use these regulations in that way. So, I mean, just going back to what Mikatona said, sorry, that, I mean, the World Health Organization has also suggested that these should be banned in schools, these front of package warning labels. And that is also just something that it can be part of the school environment where, I mean, firstly, banning it would be wonderful if in the future this regulation can be that stepping stone to that. Yeah. But then it can also be used as almost an educational purpose where we should be using these as the food system almost changes because of the food environment with the bad foods being exposed, that we can actually use that as a stepping stone to create good nutritional education campaigns, because we really do need it. It is necessary, and hopefully this is one of the ways that we can start doing that.
Yeah. Mikateka, you know what I'm curious about is, I mean, it would be wonderful to have warning labels on food, and I completely see the benefit of it. But my concern is that there's certain areas like urbanized areas where access to healthy food is simpler. And if you were not able to cook today because you know a meeting ran over at work, or if you go to the retailer, your premium retailer down the road, you part with a bit of a fortune, but you still manage to get healthy food on the table that evening. Not so for people who are living in areas that might be peri-urban areas, more remote rural areas. How does one, alongside a campaign like this, both get the healthy food into those areas, make sure it's available so that when you go to the shop, 80% of the stuff you're seeing on shop shelves is not the unhealthy processed stuff, but that there's a good mix of good food available, healthy food available? And also, how do we break the habits of saying, oh, well, I've eaten a meat curry and rice for 5 days, for 20 years of my life, and it's what I do every day. I don't eat vegetables, so why should I change now?
Yeah. So I think I'll start off by saying this is not a middle class issue. We are dealing with an NCD issue. And as also Makoma highlighted earlier on, it affects, or NCDs affect South Africans from all walks of life, whether you stay in Sandton, whether you stay in Alex, or whether you stay in Pushback Ridge in Mpumalanga, right? And I think what we need to aim towards doing is not say, okay, people are stuck in their ways, let us not do anything. We need to start. This is a start. People need to know what's in their food, and they need to be allowed and given the space to make those food choices for themselves. So that if I'm managing diabetes or any other NCDs, if I see it says, for example, whether I'm in a remote area or I'm in an urban area, if it's high in sugar, I need to avoid this. So I know, okay, fine, everything on this shelf, right, I cannot consume because I am managing my current non-communicable disease. So we need to shift the conversation from, this, if you have, then you are afforded those choices, to say it's everybody who's affected by non-communicable diseases. And you find that it's adolescents, it's Black women, and it's differently abled people that are mostly impacted or disproportionately impacted by non-communicable diseases. So we need to shift the narrative and give these individuals the choice to make informed food choices within the context that they live in. Makoma, I feel like you also had something to say. Yes.
Okay, can I also add? I like the fact that you've said in an urban area one can easily, in inverted commas, access healthy food. And the question is, why should it be different in poorer communities? The issue of obesity and non-communicable diseases cannot be handled by the Department of Health alone. Industry needs to come to the table. Other Department of Agriculture, Trade and Industry also need to come together in order to fight this. Because when industry produces food, the question is, why does it have to be unhealthy food? that's the critical question. So if the agenda of industry is to increase access to healthy food, that should be the case, whether it's an urban or a rural setting. And again, the reason why I mention agriculture is if you look in rural communities, some people are still able to produce their own food. The question is, why should it be so expensive when it is produced locally? So, like we always say, front of pack labeling is not the end by itself. There's so many sectors that still need to come to the table in order to fight non-communicable diseases and obesity.
Yeah, so it really goes to the heart of how we need to change the entire food system in our country, really.
And also just to add, I mean, with what's available, I think I've only really realized now, after really engaging in these regulations quite a lot, and how important this marketing aspect is. Because even something that's it's sort of maybe a bit more broader of the marketing and advertising of food, but if you walk into a shopping center, the first things you see are these promotions of these products that are packaged. The sodas or the sugar-sweetened beverages, you go and you see this promotion of all of these different cereals that are jam-packed with sugar and all of these things. But then it's very rare when you go into the fresh produce or something that there's a nice special for you. Maybe sometimes they'll have like a bundle special or whatever, but it's really those promotions are so intense on consumers that, I mean, obviously, and it's also as you walk into the shops or whatever it is. So, I mean, you walk in and you don't even have a choice immediately. So I think we need to obviously get the access and get more people around South Africa to be informed about what's in their food. But really, really just getting into those marketing techniques and the retailers, how responsible they also are in providing what food we have, and how even, I mean, just a shop layout, something so simple, immediately grabs someone to make sure that they get this convenient food that that's available to them.
Absolutely, and that last march to the till. You know? When you're surrounded by the most delicious sweets and chocolates in the sun.
Try doing it with a child as well.
I've tried that. Petronelle, I'm just gleaning from what is going to be expected of the changes to these legislations, that you're going to have big pushback from business. What is and they're not represented on the panel today, but I'm keen to hear what their perspective is on this, and what it has been as this campaign has taken off.
Absolutely. I can share the perspectives, and I can also share my own thoughts on those perspectives. So what we've been hearing is effectively three big things from business. So business is claiming that this changes to the labeling is going to be have a very high cost for business. Business is claiming that it will impact sort of the attractiveness of South Africa as an investment destination. And then finally, there's a whole hoo-ha about what it would now mean for trademark and intellectual property portfolios, because what the regulations propose to do is, for example, to divorce unhealthy foods from those cute little cartoons that you associate with certain cereals, for example.
Or the pictures of happy families.
Absolutely. And I think all of these things are false, firstly. Firstly, from evidence we've seen from other countries. So Mecca spoke about Chile, but we've really introduced these types of marketing restrictions in at least 20 countries worldwide. We have not yet, and labeling restrictions, we have not yet seen any kind of convincing evidence that it increases the cost of labeling. And I mean, that actually makes complete sense. We're telling businesses now, you should change your label in the future. If they print red or black on the next label, it's not going to have any implication for them. They're using a different pattern and different ink. So that's nonsense. On the trademark issue, I personally have managed trademark portfolios a long time ago when I was practicing as a commercial attorney. This idea that there's going to be this running around and companies won't have access to their trademarks is false. Most big companies register between 10 to 20 variations of their trademark, with the cute picture, without the cute picture, diagonal, vertical, etc., etc. So those trademark portfolios will have to change long term. Good. It shouldn't actually have these manipulative images in those trademarks. And WHO has clearly been saying since 2010, and evidence has been suggesting for quite a long time, that these images are harmful and is clearly aimed at enticing children to partake in these products. And businesses on the one end will tell us, oh, we'll manage ourselves, we'll do voluntary pledges, we won't target children, we won't do this, we won't do that. But we've known for a good 20 to 30 years now that this is problematic. So short term, they have many access to the intellectual property still available. Long term, they should have made these changes for a while. And the idea that economic development now in South Africa will drive is a nonsense misnomer. It's really, firstly, the companies will be impacted are imports. So it's not locally produced food. We're not seeing local producers and local laborers really reaping the rewards, getting the jobs here. In fact, it's companies from abroad coming in and externalizing their health costs, externalizing their climate costs, throwing their plastic in our rivers, and extracting our wealth. So that's, I take quite a clear line on this, that this is very much a for-profit motive. If you really want to know why businesses are pushing back, is they're worried that we're going to be buying more local and buying more fresh. And that means less profit for them.
Sure, it's going to be a very, very interesting discussion that's going to develop as these hearings continue. I'm getting some fantastic questions in from our viewers. And let's start with this one. Can the panel advise if they see a role for greater regulation of food processing in the interests of promoting health among consumers? Who can I throw that to? Makoma?
Can you please repeat the question?
So it's, can the panel advise if they see a role for greater regulation of food processing in the interests of promoting health among consumers?
I'm not sure if I'm getting the question.
So about regulating processed foods,
Okay.
as I understand it.
Okay. All right. So what the primary aim of the labeling is so that an ordinary South African will be able to identify when a food is high in fat, sugar, salt, so that they can make a decision based on information that is out there. But the greatest role that we see the labeling playing is in terms of marketing of these products to children, which we foresee that as having the highest impact. Because what we are seeing happening now is companies are selling all this processed food, but when there is less demand for processed food, what we see happening is industry or what our intention is, we see industry reducing processed food or marketing processed food because now the demand has decreased. And the other, where we are also looking into is in terms of restricting the number of processed food, ultra-processed food sold in schools.
Right.
So also that will decrease the demand for ultra-processed food, and that is where we see the labeling playing a role in controlling the amount of processing that goes into the food that is sold.
Thank you for that.
Yeah, Joan,
Yes,
maybe
yes,
just to say,
Petra?
and this is links to what Makateko was saying earlier, that, you know, labeling is not the ultimate, I hate saying it's a silver bullet because that implies a problem's a werewolf, but it's not the ultimate concern here. It's one of a suite of things that we need to do to prevent non-communicable diseases. Now, processing so broad, we've taken great steps in South Africa. We were, I think, the first country in the world to have mandatory sodium restrictions, which is a way of limiting processing. What Makoma was saying is using some of our other regulatory mechanisms to ensure that there's less access is important. Foods, but also in any kind of public institution. Why do we see really high in sugar foods being sold in hospitals, the very places where we have to treat patients with diabetes? So there's quite a number of interventions that we can look at, and hopefully one day we'll reach the point that some of our South American country compadres have reached, which is effectively saying we're going to tax ultra-processed food, because like tobacco and liquor, this is bad for you.
Yeah, yeah. And Angelica, to pick up on that, I mean, this is a really good question from a viewer who took it out of my mouth, in fact. I remember watching some visuals of the kind of content that is offered to children as a result of feeding schemes. I thought I would never want my child to eat that food. Why would any of us want any child in the country to be eating this? And this viewer asks, not all schools in South Africa provide healthy nutritional meals. What plans can we implement to ensure healthy food and the education thereof can and will reach all children living in disadvantaged areas?
Yeah.
Such a good question.
So, I mean, at the moment, there is the National School Nutrition Program that is implemented in many schools, where they do actually provide a meal to students. Of course, we've seen with the, when we've looked at what food is served to these students, that there's quite a big variation. And also, I mean, if you just look at the school environment, food environment as a whole, I mean, what is available in these tuck shops? It is ultra-processed foods, the sweeties, the chips, the biscuits, probably even the sodas and everything. Yeah. And I mean, we've discussed this now at length, at how a child has no idea if that's good for them or not. It tastes good for them. Yeah. So that's why they would buy it. So, I mean, this is what's also wonderful, is if we can be using this regulation as really a stepping stone to then start controlling the school food environment. Possibly then saying if food has a warning label on it, then maybe we shouldn't be serving it at schools at all. At tuck shops, it should be banned. There shouldn't be any kind of branding of these products at these schools, as we do see currently. And then also what food is given to these students in the the school nutrition program. So it is something that it really can be used. I mean, as Petronella said, it can be used to hopefully maybe one day tax these foods to show that this is really a stepping stone. This is the first step towards a greater improving the food environment for schools, for adults, for hospitals, and what should be put in any kind of almost child-centered setting. Yeah. So it really is, we're really hoping that will be the meaningful effect. To be able to control this non-communicable disease crisis that South Africa's in.
Yeah, yeah, and I think it would be wonderful to introduce that at school level, because of course, I mean, you're training their palates to the palates of children to crave healthy food. Somebody's asking, would it be possible to share some more recent statistics? It would be interesting to see what's transpired since 2016, 7 years ago. So, Mikateko, just off the top of your head, some short statistics, or you and Makoma could maybe throw at us?
You can start. Unfortunately, there hasn't been any big national studies since 2016. We only see pockets of small studies that were conducted in smaller communities. But in terms of numbers, I don't have, but the numbers do seem to be increasing, but just from the smaller pockets. There is now a national data intake survey that has just been completed, and we are hoping before the end of this year we'll be having new data, latest data in terms of obesity and overweight. But at the moment, data is still in the analysis stage. We are not able to share any information, but we should be able to soon.
All right, okay. I thought this was also quite a good question. What about healthy foods? Should this not also be promoted to consumers? Israel introduced a traffic light system, green, amber, red, on front of pack that is highly effective. Have we thought of that more sort of positive approach?
Yeah.
Good question.
It's interesting that in the previous regulation, or the current one, traffic light has been proposed as a possible labeling for South Africa. But we also conducted a study in South Africa, and we compared performance of the traffic light against the warning label. And across the country, irrespective of race, irrespective of educational level, the warning label came up tops. It's the one that everybody said, with this one I'm able to identify unhealthy food, I'm able to know, to differentiate whether this is healthy or unhealthy. But added to that, there's been a lot of confusion around the traffic light. In that, in some products, you'd find 3 colors appearing on the product, and in such cases, then it becomes problematic for one to come up with now the interpretation about the nutritional value of that. Is it high? Is it okay? Is it not okay? And what has been happening, what has been seen to happen is then people tend to rely on just one nutrient. If I'm interested in sugar, then I will ignore the salt, I will ignore the fat, even though we know those are also problematic. So in order to come up with one way that a person will be able to make a holistic and comprehensive interpretation of a particular food, then the warning label seemed to be the one, because then it will tell, irrespective of the nutrient, is this healthy or unhealthy.
Right. There's also a question about whether there will be any progress made in the area of educating consumers on the dangers of preservatives. And it's a great question because that's something that really hides in foods. And I know there's certain things that I can't drink that it will trigger my asthma, but then I'll immediately know after I start coughing and wheezing that there was a preservative in there that was not flagged on the labels.
So there is actually a movement that we're seeing more internationally, led by a scholar called Carlos Montero, and it's this idea of moving front of pack labeling to have a warning label for ultra-processed foods. And it's actually quite complicated to define what is ultra-processed and what's not, and we do have a working definition at this stage, but the introduction of preservatives is quite key there, because we've obviously seen it being connected to some types of cancers, etc. We are not there yet in South Africa. I mean, as we see, this is a first step. But as we are evolving in this field and as we are introducing better regulations to ensure we have food justice, I think the goal and the hope for everyone is that we at some stage move towards having an ultra-processed warning label that we can then couple with all kinds of other regulatory interventions.
Right. A question about GMO foods. I mean, this is not one I thought of off the top of my head, but one of our viewers asks, could our panelists also discuss GMO foods and the negative effect on humans? I don't think we can get into that whole issue, but from a labeling point of view, is this something that's going to be included at all? Or is it among your proposals at all?
Can I jump in?
Yeah, Angela?
So in the regulation at the moment, if a food has a front of package warning label on it, it's not going to be allowed to have any other kind of endorsement label. So I think, we don't have the time to discuss GMO foods. It's a very complex matter. But it just also shows that, there's so many different aspects to food and labeling and everything, and what foods we are actually eating. And that's the problem at the moment, that sometimes there's endorsement labels on different foods, and it might say like non-GMO or something. So now it confuses the consumer. Do I want to pick this food? Do I not? So what's wonderful about this regulation is that it's saying if there's a warning label of high in sugar, salt, or saturated fat, or artificial sweeteners, then you're not allowed to have any kind of other endorsement logo on it, or any other nutritional claim. So that's really going to help make sure that the consumer doesn't get confused when they're buying their products. I wish we could have time to discuss GMOs, but that is one sort of step when it comes to labeling, to help a consumer not be confused by that.
All right, great. So we're going to start wrapping up now, but I just want to ask for the benefit of our viewers or people they may speak to who are interested in participating in this process, who want to have their voices heard, how do they go about it?
So we do have a website that HEALA is running. It's the what'sinourfood.org.za, and there's a link there that you can go to send your public comment through that link. It's linked to the Mandla Mobi Aware to profile, and it's really been made very easy for you to do, because it is quite a difficult process of sending the right email through. So in that, on that page, there's an explanation again of these regulations, what's in them, why it's so important in South Africa, and then you can send a message. So on the right-hand side, you put in your information, your email address, your cell phone number, and then you can basically just click send, and there's a template message there already. If you want to add words of support, a story of why this FOPL or the marketing restrictions is important to you, you're also able to edit this template message, and then it goes straight to the Department of Health. And this needs to be done by next week, Friday, which the public participation process is closing on the 21st of July. So anyone that's interested, they can go to what'sinourfood.org.za.
Right. And are we happy that the process of these hearings and the outcomes will be a transparent, honest one?
We have no reason to doubt the integrity of the Department of Health at this stage. They've been very transparent and they've communicated with everyone, we would say, in best faith. So at this stage, we are quite excited to see what emerges from this process. I think if we see any movement, it would probably be done in such a way that we can all assess what is being said against the regulations and have a better understanding of what's going on behind the scenes. The department's been quite good with telling us that they'll give us an accurate accounting of what was said, how many submissions they received, and to date, we have absolutely no reason to doubt that.
Okay. Well, we're going to leave it there. Thank you so much for your participation today, Angelica, Petronelle, Makoma, and Migadeko. Really fantastic to have these insights from you. And now that you've heard all about HEALA's efforts to drum up support for these draft regulations, don't be surprised if you see activations taking place on social media and all around you. If you travel by Gautrain, you'll probably see displays of foods deemed unhealthy outside Gautrain stations. And the message is you should think twice before consuming those and try to become an active participant in determining the outcome of these hearings. Now, as you've heard, if you'd like to participate, take note of that address. I'm just going to read it out again, the website address, what'sinourfood.org.za. But the great thing is, if you look at the chat function, you will see the link there. So all you have to do is click on that, and it'll take you straight through to the page where you can eventually fill in your details and make whatever comment that you would like. And as Angelica tells us, that'll go straight to the health department. If the proposed amendments are passed, South Africa would become the first country on the continent to introduce warning labels on food. One can only hope these measures will put a dent in the diseases that we see increasing at an alarming rate in our country. Thank you to our experts for joining us and quite literally leaving us with food for thought today. Thank you to you, our viewers, for tuning into these Business Day dialogues live in partnership with HEALA and for posing your excellent questions. That's where we leave it for today. From me, Jo and Joseph, take care. Bye-bye.